let's dive right into this explainer. When we think of ancient medicine, our minds usually jump straight to, well, primitive guesswork, right? Maybe some magic or just raw, desperate survival. But today, we're going to completely flip that script. We're going to look at ancient medicine not as some frantic trial and error, but as a deeply observant science. This is the literal foundation for the modern healing we rely on today. Specifically, we're going to decode the absolute art and science of ancient bone setting. To really wrap our heads around how our ancestors engineered these medical marvels, we're going to hit 4 quick chapters: shattering the primitive myth, engineering the human body, ancient biology and chemistry, and finally, communal before clinical. Okay, so I want to start with the number 50,000. We actually have hard archaeological evidence of cleanly healed fractures in Neanderthal remains that go back over 50,000 years. Just think about that for a second. When archaeologists dig up an ancient skeleton and find a bone that is healed cleanly in proper alignment, that tells a very specific story. It means someone helped that person. Someone set that bone, kept it perfectly still, and, most importantly, kept them alive. It literally proves that organized medical care for injured group members predates us as a species. Crazy, right? This kind of mind-blowing data really challenges all of our modern assumptions. It forces us to ask, what does primitive actually mean? Were these ancient survival methods actually way more sophisticated than we give them credit for? Because honestly, they clearly weren't just telling each other to walk it off. Which brings us to Section 1, shattering the primitive myth. So, early humans understood a really fundamental truth. The human body desperately wants to heal itself. The real challenge was figuring out how to help it do that without, making things worse. So, how did they pull it off? Well, long before modern hospitals or factories, early humans basically went to the ultimate hardware store, nature. They'd head to the nearest forest or riverbank and gather rigid supports. We're talking straight sticks, river reeds, tree bark. The trick was finding something that wouldn't bend under pressure and then patting it against the skin so it wouldn't cause more damage. Some cultures packed dried mud around a limb to create a rough, hardened cast, while others stretched animal hides supertrade over an injury, letting it dry into a firm, natural brace. These definitely weren't lucky guesses. These were highly refined methods developed over generations of intense trial and, painful error. And what's amazing is how this brilliantly illustrates that the core objective of fracture care hasn't really changed in tens of thousands of years. The logic is exactly identical to what happens in a modern ER. You absolutely have to immobilize the bone so it can knit itself back together. Sure, our materials have upgraded to fancy fiberglass and polymers today, but the biological strategy, it is exactly the same. Let's move to Section 2, engineering the human body. Because ancient healers didn't just stop at tying a few sticks to a broken arm. Over time, they engineered highly complex mechanical fixes, and this highly sophisticated bone setting was happening simultaneously across the ancient world. Around 1600 BCE in Egypt, the Edwin Smith Papyrus was already detailing clinical procedures for examining breaks and applying structured dressings with padded linen. Fast forward to 400 BCE, Greece was developing intense traction techniques. And by 200 BCE, Han Dynasty China was perfecting functional bracing. We're talking about structured medical procedures here, formally written down and passed from teacher to student way, way before modern medicine was even a concept. Let's actually zoom in on ancient Greece for a second. The famous physician Hippocrates wrote extensively about bone fractures, and he laid out a fully reproducible procedure for reducing a displaced fracture. Step 1. Apply steady traction, basically a firm pulling force. Step 2, carefully align those broken ends back into the proper position. Step 3, immobilize the limb using bandages soaked in wax or resin that literally harden as they dry. Honestly, if you read this today, it feels exactly like a modern surgical protocol that they're teaching in medical schools right now. But of course, some bones presented a massive engineering challenge. Enter the femur problem. The femur is the largest, strongest bone in your entire body. So if you break it, a simple splint just isn't going to cut it. The ridiculously powerful thigh muscles immediately spasm, and they pull the broken ends of the bone apart, overlapping them and causing severe shortening of the leg. To fight this, ancient military medics like the Roman capsari, who ran the world's very first field hospitals, actually built continuous pulling frames. They engineered these intense weight-bearing traction devices just to keep the leg stretched out. They were solving a highly complex muscular problem with pure physics. Now, what is truly fascinating here is how ancient medical philosophies started to diverge. On one side, you have the Western approach, which was all about total immobility. Hippocrates was actually incredibly observant about this. He warned against the dangers of wrapping a limb too tightly, knowing that swelling inside a rigid dressing would cause severe tissue damage. But then, over in the East, traditional Chinese medicine took a totally different route. They emphasized functional bracing. They designed these brilliant bamboo splints that provided support but still allowed for gentle movement, which prevented muscle wasting and stiffness. When you contrast the two, you realize the Chinese emphasis on functional bracing was an absolute game changer. It's a core principle that modern Western orthopedics didn't even formally adopt until the 20th century. All right, moving right along to Section 3, Ancient Biology and Chemistry. So they didn't just master the physical mechanics of pulling and bracing, they also intuitively grasped the deep biochemistry of healing. To really understand the deadly stakes of ancient medicine, we have to talk about compound fractures, when the broken bone actually pierces through the skin. This was an incredibly dangerous situation because of osteomyelitis, which is a fatal infection of the bone itself. Before the invention of antibiotics, environmental bacteria getting into a bone meant almost certain death. But here's the thing. Ancient physicians knew this without even knowing what a germ was. Hippocrates aggressively fought this by advising healers to thoroughly clean the wound, clear out any debris, and cover it up as rapidly as possible to block out the outside environment. And their defense against infection and pain wasn't just physical, it was highly pharmacological. This is where it gets so cool because ancient plant-based remedies map almost perfectly to modern scientific validations. For instance, they used willow bark for pain relief. Well, today we know willow bark contains salicin, which is literally the active basis of aspirin. They used a plant called comfrey, which they practically nicknamed knitbone, as a poultice. Modern science shows comfrey contains allantoin, a compound that actively stimulates cell proliferation to speed up bone healing. And they used raw honey as a wound dressing, which we now know has incredible antibacterial properties because of its low water content and hydrogen peroxide production. So this pharmacopoeia, it wasn't just random magic potions. It was highly accurate, accumulated observation built over centuries. They even intuitively understood that food was medicine. Long before anyone discovered calcium, vitamins, or protein, ancient healers were prescribing heavily nutrient-dense diets for fracture recovery. They universally prescribed bone broth, which, as we know today, is absolutely packed with collagen precursors, minerals, and amino acids that genuinely support bone repair. Some cultures specifically prescribed eating liver, which is extraordinarily dense in vitamins, especially vitamin K, which plays a massive direct role in bone mineralization. And while they obviously couldn't see cells under a microscope, these healers accurately observed the physical stages of recovery. They could literally feel the swelling and firming of what we call a fracture callus. That's the bridge of new bone tissue that forms. Ancient texts beautifully compare this process to a tree growing new wood to seal a wound. Sure, the exact mechanism metaphor might have been a tiny bit off, but the raw observation was spot on. They knew their job was simply to give the body the stability it needed to build its own bridge. However, when a severe infection inevitably spread, they had to resort to the absolute last option, amputation. But they executed it with just incredible technique. They'd cut cleanly above the infected tissue, cauterize or literally tie off blood vessels to stop fatal bleeding, and carefully cover the wound with a skin flap. And we know for a fact this worked. Archaeologists have uncovered thousands of years-old skeletons showing smooth bone remodeling at the amputation site. That proves these patients didn't just survive an intense ancient surgery, they lived for years and years afterward. Which brings us to our final section, Section 4, Communal before Clinical. That smooth bone remodeling on an amputated limb or a shattered femur brings us to what I think is the most profound realization of this whole explainer. Think about what a healed femur actually means in the ancient world. A person with a broken thigh bone simply cannot walk, hunt, forage, or farm for months. They are completely 100% dependent on others for food, water, and protection. Therefore, a healed femur is the ultimate archaeological proof of human compassion. It's undeniable evidence of deep, deep social bonds. Someone chose to step up and keep that person alive. The medicine was communal long before it was ever clinical. And this communal care naturally gave rise to a very specific type of healer. Across the entire globe, from medieval Europe to traditional Chinese villages to indigenous communities in the Americas, the bone setter emerged independently. Now, these weren't formal physicians. They relied entirely on tactile, experiential craft that was passed down through family apprenticeships. Through pure touch, they could literally feel a fracture under the skin, manually manipulate the ends back together, and achieve complex reductions that early modern surgeons,
even with all their shiny new instruments, really struggled to match. They healed their neighbors through deep trust and incredible craft.
Every single splint, every herbal poultice, every dietary prescription was arrived at through the exact same process. Someone got hurt. Someone tried to help them. The helper observed what happened, kept what worked, and discarded what didn't. Guys, this was the scientific method, just practiced informally across thousands of years of human suffering and communal care. The gap between an ancient Egyptian physician and a modern orthopedic surgeon isn't a gap in intelligence, it's just a gap in accumulated knowledge, entirely driven by an innate human desire to care for one another. As we wrap up this explainer, I really want to leave you with this final thought. Our ancestors built the entire foundation of human survival and modern medicine simply by watching closely, learning from nature, and dedicating themselves to helping each other heal. They observed the world and literally changed the future of our species. So look around. If observation built modern medicine, what are we observing today that's going to shape the healing of tomorrow?